Supraspinatus, Infraspinatus, Teres Minor, and on the anterior surface of the scapula, the Subscapularis.
Supraspinous fossa above the spine of the scapula. The supraspinatus then passes underneath the acromion to attach onto the greater tuberosity on its superior facet. In terms of its action, the supraspinatus muscle in isolation creates abduction of the humerus. The muscle is innervated by the suprascapular nerve. The next muscle is the infraspinatus, so from its name we can tell that it's located below the spine of the scapula. And it sits within the infraspinous fossa. The infraspinatus muscle inserts onto the greater tuberosity of the humerus on its middle facet, just below the insertion of the supraspinatus muscle. In isolation, the infraspinatus muscle performs lateral rotation or external rotation of the humerus. It's worth noting that the supraspinatus and infraspinatus share a nerve supply derived from the suprascapular nerve, which comes off the superior trunk of the brachial plexus to supply both of these muscles. Next, we have the Teres Minor muscle. The Teres Minor muscle is located just inferior to the infraspinatus on the lateral border of the scapula. It then inserts onto the greater tuberosity of the humerus on its muscles so far, the supraspinatus, infraspinatus, and Teres Minor, which all insert onto the greater tuberosity on the superior, middle, and inferior facets respectively. In isolation, the Teres Minor muscle performs external or lateral rotation of the humerus. The nerve supply to the Teres Minor muscle is derived from the axillary nerve. The final nerve. The final muscle to talk about is the Subscapularis. The Subscapularis muscle sits on the anterior surface of the scapula. If we now remove the rib cage, we can take a closer look at this muscle. The Subscapularis originates in the subscapular fossa, which is this depression occupying almost all of the anterior part of the scapula. The Subscapularis muscle inserts onto the lesser tuberosity of the humerus, which you can see here. The subscapularis is the largest and strongest rotator cuff muscle, accounting for approximately 50% of the cuff strength output. When you isolate this muscle, it performs medial or internal rotation of the humerus. The subscapularis is innervated by the subscapular nerves, which is comprised of the upper subscapular nerve and the lower subscapular nerve. Both these nerves originate from the posterior cord of the brachial plexus.
Standing shoulder external rotation.